My name's Dr. Jeffrey Garofalo of the Midwest Disc Clinic, author of Never Look Back, A Simple Guide to the Cause and Care for Back Pain, and developer of Dose. If you're here, you've taken our quiz, and I'd like to give you some tips and tricks to help yourself out with sciatica. Now, if you scored 0 to 3 or 4 to 8, you're probably wondering where these numbers come from and how that happened. Well, we've designed our quiz to be very specific to help us lead towards potential ideas of diagnosis. And between 0 and 3, potentially, you have more of a muscle issue called a piriformis syndrome in the rear end. Potentially, you have more inflammatory issues going along your low back, causing irritation to the sciatic nerve. And if you're 4 or above, using our questionnaires, potentially, you have more of an issue with a disc or a spinal joint called a facet joint being misaligned and irritated, and you have more going on. There could be more going on, and you might need more help. Now, let's get some obligatory things out of the way. I am not diagnosing you. I am not telling you what you have, and I am not your doctor. So if you choose not to follow what I tell you to do, absolutely fine. If you do, please make sure you're doing it at your own risk. There's nothing here that's going to get you hurt. But again, if you're doing any of the things that I tell you about today, and either A, symptoms get worse or they don't resolve, either get to the emergency room, get to your doctor, or call us quickly and we'll help you out. So now that that's out of the way, again, I'm not here diagnosing anything. We're saying 0 to 3 could possibly indicate something less like a muscle or inflammation, and 4 above could indicate something more. And so let's talk about first 0 to 3. If we think there's potential for a muscle problem called a piriformis syndrome, then there's a couple things we can do if it's A, piriformis syndrome, B, an inflammatory, inflamed area in the low back causing irritation chemically to the sciatic nerve. There's a couple things we can do that I want to share with you that should help you pretty quickly. As long as it helps pretty quickly, a day or two, and stays that way, you're good to go. If it doesn't, and it worsens or it doesn't get any better after, I'd say, about 2 weeks, then you absolutely could have more of an issue and you might need some help beyond what you're currently doing and what I'm giving you. You either can give us a call at 260-768-4712, and we're going to give you your first visit with $100 off as long as you mention the code Spinal Disc Help. Spinal Disc Help, when you call, we'll know to give you $100 off and you came from this site. Now, let's give you a couple tips and tricks you can utilize if you have what we call a piriformis syndrome. Now, the piriformis is located in the middle of your rear end cheek, right in the middle of your rear end cheek, and it attaches from the tailbone out to your hip right here. So one of the things we can do to relax that is very simply grab a massage gun. And I like to use kind of this little pointed tip here. And what you'll do is 7 to 10 minutes, you'll massage right in the middle of the rear end cheek, right in the middle of the rear end cheek, out to the side. Rear end cheek out to the side, about 7 to 10 minutes. You can also take a tennis ball or a golf ball, and you can massage in the rear end cheek to relax the sciatic nerve. The piriformis muscle, which sits on top of the sciatic nerve, if this sciatic nerve, the piriformis muscle, it sits right on top. So when it's inflamed, it grabs the nerve that goes down your leg and causes that pain. If you'll massage that muscle with either a massage gun, a golf ball, or a tennis ball, that should release it and it should offer pain relief. If that releases the muscle and the pain down the leg goes away, you know you have a piriformis syndrome. If it doesn't come back, you solved it. If it comes back, you could have more of a problem. See your doctor, go to the emergency room, see us. The other thing you can do for piriformis syndrome, and I'm going to share this with you, is we can stretch the muscle. And we take a chair like this. We would sit like this, nice and straight. You would put your leg up as this, so you're sitting, you're putting your hand on your knee, your foot on your ankle, you're sitting up straight, and you just don't push on anything, just sit up tall. Some of you will feel the stretch in there immediately. If you don't feel it, just lean forward a little bit. When you lean forward, keeping your back straight, you will feel that muscle stretch nicely. So you can hold it for about 30 seconds to a minute while taking deep breaths, and then you can potentially do the other side to keep things balanced, even if you don't have a piriformis syndrome there. let's just say it's not a piriformis syndrome. Let's just say it's some inflammation in across the low back. Very simply, we recommend to our patients, again, you're not our patient, but this is what we recommend to our patients who we've diagnosed with just inflammation, a hot shower for 10 minutes. Let the hot water hit right across the low back, just above the rear end to where the sciatic nerve comes out for 10 minutes. That's gonna relax the muscles, and it's gonna take blood flow deep into the tissue where you need that healing. Immediately get out of the shower after 10 minutes and grab one of these handy dandy ice packs and put it right across your low back immediately, because if there's inflammation in that low back, it could irritate the sciatic nerve in that low back, and you want to calm that inflammation down by then using the ice pack. We call it contrast therapy. So hot shower for 10 minutes, relax the muscles, and then immediately after you get out of the shower, put an ice pack on for 10 minutes, every hour you can for 10 minutes. If your sciatica is due to inflammation of the lower back, that should solve the problem. Again, if it doesn't solve it long term, it gets worse immediately, it gets worse in the next 2 weeks, there could be more of a problem going on, and you'll either need to call 911, go to the emergency room, see your doc, or call us. You can call us at 260-768-4712. Mention spinal disc help, and we'll give you $100 off your very first visit. Now, let's assume you're in the category of 4 and above. Again, 4 and above to us within our office might indicate there's more going on, such as a disc, such as a spinal misalignment, or something else going on. And we in our office will identify that via hands-on exam, very astute consultation history, full set of spinal x-rays, and an MRI. You see, to see is to know, to not see is to guess, and we don't guess with anything. So if you've got a 4 and above, there's a possibility, I'm not saying for sure, I'm not diagnosing you, but there could be more going on. And you'd want to know, hey, look, what is the exact cause? So if you're category 0 to 3, and what we're telling you doesn't work, and you're sick and tired of it, or you're 4 and above, and you've tried other things, and you want help, we help sciatic patients non-surgically get their lives back and enjoy life again non-surgically. You give us a call at 260-768-4712 and mention the code Disc Help Now. Spinal Disc Help. Spinal Disc Help is the code, and we'll give you $100 off your first visit. Again, call 260-768-4712. I'm Dr. Jeff. I hope you enjoyed the tips and tricks. You can check me out on Facebook, YouTube, Instagram. You can check me out on X. I'm here to help you get better non-surgically and live the life you want to live. Get your life back.